Milwaukee Healthcare Partnership is a public-private consortium that's dedicated to improving healthcare for low-income, vulnerable populations in Milwaukee County. It was initiated in 2007, and its members include the 4 Milwaukee-based health systems, so Ascension, Aurora, Frederick Medical College, Children's, the 5 federally qualified health centers, and as well as the city, county, and health state agencies that are involved in the provision and policies of care for low-income people in our community. So the specific program is called ED to Medical Home, where we target low-income, Medicaid, uninsured individuals who are not connected with a primary care medical home, who also may have a chronic condition and need ongoing care. And we use that emergency department appointment to connect them with a primary care medical home.
A lot of patients have traditionally used the ED as their primary source of care. They might not even be aware of some of these fantastic community clinics blocks from their house. So I think knowing that there's a resource in their community that'll take care of them on an ongoing basis, not just a new doctor every time you go to the ED, but someone that knows you and a clinic that knows you, I just think is a really good way to deliver care.
So the challenges that we had in the emergency department were really referring the underinsured patients to primary care. When we had patients that needed to be close to their home in their communities, we didn't have a mechanism to be able to do that successfully.
We really had no good way of communicating with the discharged people who were in the EDs. We would find out that patients had been in the emergency room and had been sent to us, but we had no records. We had no way to anticipate that they were going to come to one of our facilities.
The Coverage to Care case manager needed to contact each of those providers, outside providers, so a hospital, safety net clinic individually, in order to find accessibility to post-discharge appointments.
And the challenge is really this inter-system scheduling, that every health system, every clinic is on a different electronic medical record, or at least they don't play nice with each other. So My Health Direct is a way that all clinics can schedule with each other.
My Health Direct gives patients options. And so the ED staff, our care coordinators that manage patients in the ED, they find the tool very helpful and very useful. So it's been a big benefit and added value to the care that we deliver to our patients.
It's really a patient-centered approach. While previously, a clinic staff, a social worker might say, hey, here's the clinic I'm going to send you to. With My Health Direct, they get a menu of available clinics in the community as well as when those appointments are. So it's really patient choice of where do they want to go and when do they want to go, which I really think helps show rate and engages the patient that they have the say in where they go.
Care coordination allows the client, those involved in the client's care, to all communicate together, creating a well-developed care plan for this client, therefore meeting the patient's needs and improving their well-being in the community.
We are fortunate enough today to be able to find a primary care doctor for anybody in the community regardless of their payer status. And I think that has been really the biggest change that we've had. So we can tell anybody in this emergency department if they need follow-up with primary care that we can get them a primary care doctor within 7 to 10 days.
We were able to demonstrate that by connecting individuals to primary care, supported by the My Health Direct tool, that we were able to reduce subsequent ED utilization by 44%. We also have demonstrated that we can collaborate across the community effectively and spread best practices, and are doing that in other areas as well.
We think the model in Milwaukee where competing hospitals are collaborating together to improve access to care and cost is a model that should be exported into many different communities in the United States.
I think this system that we have in Milwaukee is unique and out in front. I hope we can tell as many communities as we can about it, because being able to provide this kind of opportunity for care for patients, I think is the way that we are going to help give the trust that we need to patients that they can go to a medical home in a safe way.
The partnership has really helped us, has given us a place at the table with the with the hospital systems.
It's a win-win for everyone, the providers, our care coordinators, and the patients.